Welcome to the Nordic Venture Show, your speed date with the hottest Nordic innovations and ventures. In this episode, our venture date is with Nightingale Health, building sustainable healthcare.
If you're listening to this, you're probably like us, right? You want to understand what really matters, but you don't have time to wade through all the noise. Well, today, we're doing just that. We're diving deep into this material you sent over on Nightingale Health. They're this health tech company.
Yeah.
And, we're going to figure out exactly what they're doing in this whole sustainable healthcare thing.
Yeah, you've given us a lot to work with here. You've got info on their standard health checks, the remote ones too.
Yeah.
Plus all this stuff about their technology and their whole mission. And they seem to be all over the place. Healthcare providers, insurance, even governments are using their stuff. And there's telehealth and consumer health and research too. Oh, and don't forget the recent news. It's a lot.
Okay, so let's start with the big picture. Their mission statement says they're all about building sustainable healthcare and reducing health inequalities. I mean, that's a pretty ambitious goal.
Mm-hmm.
When you look at everything they're doing, where do they even begin to tackle something like that?
Well, the really interesting thing is they're starting by fundamentally changing how we think about blood testing. You see, for years, the focus has been on individual markers in your blood, like checking for cholesterol or glucose levels. And you get a separate test for each specific disease. What Nightingale is doing is totally different. They're taking a single blood sample, and from that, they can create this complete multi-disease risk profile.
So instead of looking for one thing at a time, they're getting a much broader view with just one test. That's pretty impressive. But how does that even work? I mean, how do they get all that information from a single sample?
Okay, so their secret sauce is this combination of two really powerful things. The first is their own lab process. It uses, it's called nuclear magnetic resonance spectroscopy, or NMR.
NMR, yeah. Isn't that like a fancy MRI, but for blood?
Exactly. Instead of taking pictures of your organs, it analyzes the molecules in your blood sample, gives them this really detailed breakdown of what's in there. And then comes the second part.
Right, so they have all this detailed data. But what do they do with it? How do they turn it into something useful for, actually understanding someone's health risks?
Well, that's where the algorithm comes in. They've developed this incredible algorithm that uses machine learning. It's been trained on, get this, the world's largest health outcome data sets. We're talking about massive amounts of data from all over the globe. So this algorithm can spot patterns in your blood work that are linked to future disease development, even patterns that regular analysis might miss.
Wow. So it's not just about what's in your blood right now, but what that might mean for your health years down the line. Pretty powerful stuff.
Oh, and they don't stop there. This algorithm actually transforms the raw data into standard medical blood markers, the kind doctors use all the time. And then they combine that with all this health outcome data. It's what allows them to calculate those multi-disease risk models.
So they're saying they have the most advanced risk detection tool in the world. Did they actually back that up? I mean, is there any evidence to support that claim?
Yeah, they do make some pretty bold claims, but they're not just pulling this out of thin air. They're really emphasizing that they are the only company doing this kind of omic technology at such a large scale.
Omic technology.
All right, sorry. Omics basically refers to technology that analyzes huge sets of biological data. Think of it like genomics, but for all sorts of molecules in your body. And Nightingale has spent the last decade building their technology specifically for primary healthcare systems, like nationwide use.
That makes sense. It's one thing to invent something cool in the lab, but it's a whole other challenge to make it work in the real world, especially in healthcare, where you have to think about cost and access and all these existing systems.
Absolutely. And that's another thing they're proud of. Their technology can be used by regular healthcare professionals without needing a ton of extra training. It just slots right into existing healthcare workflows.
Okay, so that's the technology side, but let's get practical. How are they actually using this in different parts of the healthcare system? The material breaks it down by sector. Let's start with healthcare providers. What's the main problem they're trying to solve there?
Well, think about it. The biggest challenge for healthcare providers is how do you actually prevent chronic diseases before they become a serious problem? And the way we usually do risk assessments is pretty limited. You get one blood test for cholesterol, another for diabetes risk, maybe a physical exam, a bunch of questionnaires. It's all very piecemeal.
So a lot of separate tests, and then the doctor has to put all the pieces together.
Exactly. It's time-consuming, it's inefficient. What the Nightingale Health Check does is it replaces all those separate tests with a single blood test that can simultaneously assess a patient's risk for like a whole bunch of chronic diseases. We're talking diabetes, heart disease, kidney disease, liver problems, even lung issues.
So instead of multiple tests and appointments, you get a much clearer picture from just one sample.
Precisely. And because the results are presented in terms of specific disease risks, the doctor can use existing guidelines to decide what to do next. Maybe they recommend lifestyle changes or prescribe medication or refer the patient to a specialist. It's about catching those risks early and then acting on them using the tools we already have.
That makes sense. It's about being proactive, not reactive.
Yeah.
Okay, what about insurance companies? How does this benefit them?
Well, for insurance companies, the name of the game is risk assessment, right? They need to figure out how likely someone is to get sick so they can set premiums and manage their overall risk. And the Nightingale Health Check is like a gold mine for them
How so?
because it gives them a much more accurate and detailed picture of an individual's risk for a whole range of diseases.
Yeah.
And they can get this from a single blood sample. It doesn't even matter if it's done at a lab or at home using the remote testing option.
Right, they have that remote testing option too, so it's convenient.
Exactly. So with this information, insurers can do a couple of things. One, they can set premiums more fairly based on actual risk. Two, they can identify individuals who are at high risk and offer them targeted programs to help them stay healthy. Things like wellness coaching or discounts on gym memberships, or even rewards for hitting certain health goals.
So it's not just about paying out claims when people get sick. It's about preventing those illnesses in the first place.
Right. And that saves everyone money in the long run. Now, when we think about governments and large health systems, it's a slightly different story.
Yeah, their focus is more on the big picture, right? Population health.
Exactly.
Right.
And one of their biggest challenges is figuring out what actually works. You implement a new public health program or you change a policy, but how do you know if it's actually making a difference?
Yeah, you need a way to measure the impact.
Right. And that's where the Nightingale Health Check comes in. Because it provides this standardized, reliable way to measure disease risk across large populations, you can actually track how those risks change over time. Like imagine you launch a campaign to reduce diabetes risk. You can use the Nightingale test to see if the population's risk profile actually improves after the campaign.
That's pretty cool. You're not just looking at how many people get sick, but you're actually measuring the underlying risk factors.
And what's really exciting is the idea of moving towards an outcome-based healthcare system. Instead of just paying for services, we start paying for results. And we can use these changes in disease risk profiles as a key performance indicator. So if a particular intervention actually reduces the population's risk, then it gets funded.
That makes a lot of sense. Okay, let's switch gears a bit and talk about consumer health and telehealth. These are areas that are really taking off right now. How does Nightingale fit into that?
Well, they've got this product called the Nightingale Remote Health Check. And it's basically a game changer for consumer health companies. It's a complete remote testing solution. So you collect a blood sample at home, send it in, and they run it through their whole analysis process.
So it's like those at-home DNA testing kits, but for a much wider range of health information.
Yeah, except it's way more advanced. You get a full panel of blood markers, plus the multi-disease risk assessment. So consumers can actually see how their lifestyle choices are impacting their health in a really tangible way. Like if you're trying to eat healthier and exercise more, you can actually see if those efforts are lowering your risk for things like diabetes or heart disease.
That's great motivation, right? You can see the direct results of your efforts. What about telehealth? How does it help them?
One of the biggest limitations of telehealth has been the lack of good remote testing options. You can have a video consultation with a doctor, but it's hard to do a thorough health check remotely. But the Nightingale Remote Health Check solves that problem. It gives telehealth providers a way to assess multiple disease risks without the patient having to come into the clinic.
So it makes telehealth much more comprehensive and, I guess, more proactive too.
Exactly. And because the results are tied to those existing clinical guidelines, the telehealth doctor can recommend the appropriate interventions, just like they would in person. Okay, last but not least, we have to talk about research. Nightingale seems to be heavily involved in that world as well.
Yeah, the material mentions over 600 peer-reviewed publications using their technology. That's a lot.
It's huge, and it really speaks to the credibility of their technology. They're working with over 200 medical research organizations in over 30 countries. And because their technology is already clinically validated, it means that research findings can be translated into real-world applications much faster.
That's a big deal. It means patients can benefit from those discoveries sooner. And they're also offering global blood sample analysis services to other researchers. They call themselves the gold standard omics for the research community.
Yeah, they're not shy about their accomplishments. And to be fair, they do seem to have the data to back it up. They claim that no other omic technology has been validated to the same extent.
Okay, last thing, there's a section on recent news. It says Nightingale has been approved for listing on NASDAQ Helsinki and will start trading there soon. They're also planning to list on the OTCQX in the U.S. in March 2025, and their finished prospectus has been approved.
Yeah, this is all really positive news for them. It shows they're growing, they're expanding, they're attracting investment, and the approval of the prospectus just adds to their credibility and legitimacy.
So taking all of this into account, what would you say is the most important takeaway for someone who wants to understand Nightingale Health?
Well, I think the key is this. They've completely changed how we think about disease risk detection. Instead of looking for one thing at a time, they're using advanced technology to create a much more comprehensive picture of an individual's health risks. And they're doing this from a single blood sample, which is pretty amazing.
Yeah, that's the big aha moment for me, too.
Yeah.
The shift from individual markers to this multi-disease risk profile. It feels like we're entering a new era of preventative healthcare.
Absolutely. And it makes you wonder, what are the possibilities now that we have this kind of insight? How will this change the way we manage our own health? How will it reshape healthcare systems?
It's a lot to think about. And on that note, I think we'll leave it there for today.
Yeah, good deep dive. Lots to ponder.
Thanks for listening, everyone. Until next time, keep diving.
Thanks for listening to the Nordic Venture Show. Don't forget to subscribe and stay tuned for more stories of innovation from the Nordics.